Deadly coronavirus has now been discovered inside the United States. In China, officials say the virus has killed at least 9 people and infected 473 others. Millions are wearing masks and taking other precautions. The virus has reached several other countries in Asia and is now here in this country in Washington state. A man in his 30s recently returned from Wuhan, that's the epicenter of the outbreak. He is now in isolation at a hospital in Everett, Washington, that's north of Seattle. Carter Evans is there now with more on this story. Carter, this has got to be very unsettling. So what can you tell us about the precautions that doctors are taking?
Well, you just said it. They put that man who contracted the coronavirus in isolation here at Providence Regional Medical Center. They're not releasing his name, but what they're trying to do right now is retrace his steps to determine who else might have been exposed.
2 nights ago, the man in his 30s checked into this hospital hours after he was diagnosed with the coronavirus. It was 5 days after he arrived back in the U.S. He contracted the virus while in Wuhan, even though he didn't go to the animal and seafood market where it originated.
He was traveling alone socially, but surrounded by others, and so that is part of the work that's being done to identify who those others in close proximity to him that would need follow-up education and monitoring.
Education and monitoring are 2 of several steps U.S. health officials and the CDC are taking to stop the illness in its tracks after determining it is transmissible from person to person. Major airports in Atlanta and Chicago will be added as screening centers for passengers arriving from Wuhan. Every person coming from that region will be rerouted through one of these 5 airports before they're allowed into the U.S.
If this patient is doing well, we will work closely with our partners at the State Health Department to continue to ensure that we're taking good care of him.
Dr. Nancy Messonnier of the CDC says that even following the first confirmed U.S. case, the global health community is confident the overall risk to the public is low.
Anytime there's emergence of a new disease, it's concerning. But in this particular situation, we've been very proactive in putting in place measures to help protect the American public.
Now, hospital officials say the man will likely be in quarantine for the next 36 hours or so, just as a precaution. Once his symptoms pass, he'll be allowed to go home. Anthony?
Carter, thank you.